6 weeks after the end of military operations in Gaza, life is returning to normal as Palestinians try to rebuild their shattered lives. The bombing and destruction has left medical services struggling to cope. Delegates from organisations working in the region were in London for a conference organised by Medical Aid Palestine.
We've worked in the area for 25 years in the whole of the Palestinian territories, and so we've been involved with the health issues affecting mothers, babies, young children, sort of disease, immunisation, all those sort of issues, and we've worked with it long term. And so today we're bringing together health professionals who've worked in the region, health professionals here for an exchange of understanding and information and ways of bringing forward the health issues as a basic human right in Gaza.
Called Health Under Occupation, Health Under Fire, the aim was to develop a unified response to healthcare in Gaza.
I mean, there have just been not just the deaths that we've all seen and read about, but there also have been displacements of many people from their homes, living in squalid conditions, living in tents, taking refuge in schools. So lots of people living in very dire circumstances, many health issues, many wounded. And so the bringing together of expertise as to how to address this crisis is really vital.
The conference follows the publication of a report in the respected Lancet medical journal outlining healthcare conditions in Palestine.
We have a fragmentation of land, a colonization of land to build Israeli settlements on Palestinian land, lack of control over borders, water, resources, making it practically impossible to have a public health approach to the solution of health problems.
Other health professionals spoke about how stabilisation is helping healthcare in Palestine recover.
The system is now functioning more or less as it was before the war. There are a few health facilities which are, well, a couple of clinics that were completely destroyed and some others with some serious damages, but most of them are still back. The staff are back. And slightly paradoxically, the situation on supplies and equipment is better because very large volumes of donations were received, mainly pharmaceuticals and consumables, also some equipment. And of course there were very severe shortages before this thing started. So in that sense it's better, but there are of course some serious risks.
And while money is important, it has to be spent to ensure it improves healthcare on a number of fronts.
It needs to be money not just to support the immediate response and the early recovery, but it needs to be sustained and enduring and in conditions where it's possible to help the health system recover not just from the war but from the long-term effects of the siege, with support, investment, training, enabling doctors to get in and out, to develop specialties that are sorely need to be developed in Gaza.
The conference aims to explore the health needs of those in Gaza and to formulate a long-term healthcare programme of help.